This segment of Good Company was sponsored by Summa Health.
Today we're talking about a topic that really everyone needs to discuss and definitely get more information on. We're here at Summa Health and we've got Dr. Jakob joining us right now, a medical oncologist. Doctor, thank you so much for being with us.
I'd like to thank the team for the opportunity to be here. I know it's an honor. Thank you.
Well, we want to talk about colon cancer, colorectal cancer. Let's talk about screenings and how important it is.
So screening should start at age 45. The United States Preventive Services Task Force, that's a government-sponsored but independent body of physicians and experts, revised their recommendations last year. It turned out that over the past 20 years, colon cancer has increased by about 15% in the age 40 to 49 group. The task force did a very sophisticated computer modeling, and they found that additional lives could be saved if screening started at age 45.
It's one of these things where you don't know it's happening unless you get it checked, right? I mean, symptoms, what things should we look for as far as, wait a minute, maybe there's a problem?
So that's an excellent point. You're right. Someone could conceivably have a pretty advanced colon or rectal cancer and actually not have symptoms. The screening recommendations are for people without symptoms, and if you look at the fine print of the task force recommendations and in the articles and white papers that they put out, they specifically say these are for patients without symptoms. That group of folks is people age 45 to 75. But your other point is also important. Someone could have had a colonoscopy at, say, age 45, and at age 50, they might have intractable constipation or abdominal pain or something like that, in which case they should certainly get checked out because people have cancers that developed in between screenings all the time.
I'm actually very intrigued by the fact that most people think, I don't want to get a colonoscopy, when in fact, doctor, it is one of the easiest procedures out there.
Well, I hear you, and the colonoscopy can be a bit involved. Because of the type of procedure it is, it does involve a pretty extensive prep. There are also sometimes issues with getting the patients transported to the place that does the colonoscopy. There are other ways to get screened for colon cancer that involve actually tests on the stool. Okay. In addition, there's a newer technology called CT colonography, which is exactly what it sounds like. You use a CAT scan with some special dye to actually look at the colon, but that also requires a prep.
Let's talk about treatments for colorectal cancer, because having that particular kind of cancer, there are ways to combat that.
Yeah, the mainstay of treatment has always been, and maybe will always be, surgery. So at the end of the day, with colon cancer, provided that someone is medically fit and doesn't have other significant medical issues, they're going to be getting surgery. Rectal cancer is a little more involved. There are some treatment plans that involve not doing surgery, but that's not particularly ready for prime time as of yet. At the end of the day, treatment for colon or rectal cancer pretty much begins and sometimes ends with surgery.
Thank you so much, doctor, for the insight. And for more information, this is what it's all about, getting more information and being aware. Simply go to summahealth.org/cancer.